Hey, Dr. Shakib here from Irvine Spinal Wellness Center, and I'm doing a video on how in my office we treat conditions that are related to lower back pain. This has to do with the pose that is actually a developmental kinesiology, something that we all did as infants. So in this pose, the patient, we're going to practice disassociating the mid-back from the lower back, which is a source of most lower back problems. So what ends up happening is if you are weak with certain muscles, those muscles are not able to perform their task, we start using the mechanics of our skeletal system, our bones, to give an advantage to a muscle that is weak. So for example, if my lower abs are not able to assist in lifting the leg into this position, I will arch my back and then kind of maneuver my chest up to try to jumpstart that move. So in this pose, we want to break that wrong pattern of movement because it's only leading us to the wrong destination. So in this pose, what we're going to do has to do with holding the arms up in a 3-month position. We're going to disassociate the rib cage, the mid-back area, from the lower back. In this case, Desiree is just laying down here, making sure there is no arch in the lower back area. The rib cage is nice and flat. The knees are slightly separated from each other and the feet are a little bit together. And then we try to engage the lower abdominal muscles, which are connected to the top of the pubic bone, to contract them to slightly tilt the pelvis. So that's the move, and I'm going to use the spine to show it more. To practice this with the patients, I put my hand there, you relax your rib cage, start engaging the lower back into this vertebra that I'm touching on your spine. Go ahead and do that. Very good. So let's go ahead and do what most people will end up doing, which is you arch your back. The chest does a lot of movement, so go ahead and press into this. And so there's a lot of rib cage coming down and rib cage going up as the pelvis and the lumbar spine or the lower back are moving. Now you may think this is pretty simple. How is that going to help you? It's tremendously helpful, because if the lower back muscles are engaged for lower back movements and the mid-back area are engaged with the mid-back movements like they're supposed to, then these muscles will not get tired because you're doing another region's tasks. So let's go ahead and show this spine here. In this spine, as Desiree was laying down on her back, what was happening is you're going to have to pretend this curve doesn't exist. This model is not designed to touch the floor. So assuming this is touching the floor and the pelvis is in this position, this is the top of the pubic area. Abdominal muscles are connected from here and they go to the lower part of your rib cage. So imagine they're not attached to the spine, they're in front of it because they're in front of the body, and they're going to pull this up and they're going to contract and pull. Because of the contraction of the lower ab, there's a slight movement of the pelvis up. This movement in babies is the initiation of the lower abdominal muscles, and slightly above them, the track between the brain and those muscles through repetition are established. They're walked on. The muscles are engaging, and through repetition, they get stronger and stronger until we get to the next pose. So in the practice, what we do in the office and what makes it work so effectively is we walk down the path that we all did as babies to develop the strength and develop the neurological pathway, so the movements are done properly. You will be amazed at how effective this is and how important it is to realize the simplicity in the solution and yet the perfection in the movement. So that may be a little bit of a complex statement. You may want to rewind this, I don't know, but I hope that you realize that the solution to your problem more than likely is a lot simpler than you think, and yet the solutions coming from different specialties are very much tunnel vision in a way, and that is why we're not getting effective and long-term results. Hope this helped. If you have any questions, give us a call and we'll be more than glad to see you at the office. Take care.